Hello, everyone. Welcome to Health Professional Radio. I'm your host for today, Tabitha Moretto. Our guest today is Matthew Cherian. He is the CEO and Managing Director of Global Health Limited since 2002. Global Health is one of Australia's longest established and most experienced developers of software applications for the healthcare industry. Today, we're going to talk about some of his company's applications specifically designed for the healthcare industry, such as Lifecard and HotHealth. This is his second appearance on the show. Without further ado, welcome back to the show, Matthew. It's an honor to have you again.
Thank you, Tabitha. It's great to be back.
Yes. So now, Matthew, tell us more about your company, please, Global Health Limited.
Well, so Global Health Limited specializes in software applications for healthcare. We've got this fairly consistent vision of connecting clinicians and consumers. So we see the challenges of healthcare are best resolved both in terms of productivity and also in terms of patient outcomes if clinicians and consumers worked better together. Information was shared across the health ecosystem.
Wow, that's very interesting. So now, Matthew, let's talk about these wonderful applications that your company has developed for the healthcare industry. So let's start with the first one. What is RefferalNet?
So RefferalNet is a connectivity platform. So there is, in Australia, for example, approximately about 1 billion pieces of paper that gets exchanged between healthcare providers. This includes orders for pathology, referrals to specialists, prescriptions, requests for admission, correspondence between aged care hospitals, GP, and all that sort of stuff. About 1 billion pieces of paper, results coming back, progress notes coming back, and that's hugely inefficient and risky. Inefficient because obviously data's got to be rekeyed, risky because the data is not necessarily received in a timely manner and often is got to be scanned and attached to the right patient record, or there could be transcription errors. So this whole area of getting data to flow digitally across healthcare is like the foundation of getting some significant gains through the use of technology in healthcare. So RefferalNet is a secure messaging platform that allows the exchange of correspondence in a digital format between the various healthcare providers involved in your care.
Wow, this sounds like a very interesting application, especially when it comes to secured messaging. I agree with you, Matthew, with what you said earlier, that when it comes to correspondence sometimes, especially many years ago, we correspond using paper, basically. And as you know, papers can get lost, papers can get destroyed. But with this application of yours, it sounds like it's a good way to make sure that messages are secured, especially when they're exchanged.
Absolutely. I mean, the use of paper has got so many vulnerabilities as you've identified. And what secure messaging does is it also ensures that you are dealing with the person who says they are. So it's got very strong encryption. It's also got very strong digital signatures. So you can't say I didn't send that correspondence. And you know that if I'm sending something to you, Tabitha, using RefferalNet, that it is in fact Matthew Cherian that sent it to you. So we look after the encryption of the message. So instead of sending a postcard through the internet, which everyone can read, you're sending something that's encrypted, right, in an envelope, secure, and that only the recipient can read. So even we can't read what's in the correspondence, right, as the platform vendor. So it's security, and and of course at the other end, it normally goes straight into the clinical product. So there's no rekeying of data and all that sort of stuff.
Excellent, Matthew. Now let's talk about the next application. What is Lifecard?
So Lifecard it's got three real segments that we're targeting. So for those of us that like to have our health records in one spot, so if we're traveling a lot, or if we are, going from one place to another, we want to be able to recall what our pathology was, what our meds are, what allergies we have, and so on. Because as consumers, we often have to tell our stories over and over again. Every time we go to a new practitioner, whether it's a GP, a specialist, or psychologist, or whoever, we end up having to fill up the same information, which is our history, mostly our and then our parents' history, our mother's history, our father's history, and we've got to repeat that story. And of course, as you get older, you tend to forget these things. So the first segment is for people who want a portable health record with all their data in one place securely. The second segment that we're targeting is that we think we can help is the people that are passionate about keeping up with their health. In other words, they want to maintain their wellness, if you like. So these are guys that want to monitor certain KPIs, whether it be their sugar, whether it be their cholesterol, whether it be their PSA, or all the indicators that we know we have to keep track of to stay healthy. So these are, if you like, the worried well. The third segment is probably the most important. These are the people with lifelong health conditions. So you've been diagnosed with hypertension or diabetes or a mental health issue or asthma, something that needs to be managed for the rest of your life in order to prevent escalation into a more serious condition. So these are people that need to manage their health proactively. And often they need to work with their clinicians, and not just one clinician, but a team of clinicians. A dietitian, a psychologist, an endocrinologist, multiple specialities working with you. And then you are doing whatever you can to make sure that your condition doesn't escalate so you can maintain your quality of life longer. So that's what Lifecard is. It's essentially a health record, your personal health record. It's got the ability, depending on the condition that we're trying to help, to sort of change your behavior. That's it, Lifecard in a nutshell. It's a personal health record.
Wow, this sounds like a very excellent application because, as you know, like what you mentioned earlier, every time we go to a different doctor, we have to repeat all the health information to each and every one of them because, as you mentioned earlier, as we get older, we might forget certain details about our health history or family history. So I like the idea with this health card, or this life card rather, that all of your information is recorded onto this personal health record. That way, every time you go to a doctor, you don't have to repeat anything.
That's right. And it's on your phone. It's available on Google and on the iPhone, obviously. And it just uses, secure messaging, obviously, because data needs to flow into your health record, ideally. Or you can just enter it yourself or take your camera or add documents. But ideally, we want a connected health system so that information can flow between healthcare providers and also between them and you as a consumer.
Wow, very interesting. I think I should download this application myself.
You should.
Oh, thank you. Yes, I'll do that then. Mm-hmm. Okay, so let's talk about the last application, HotHealth. Is this the same with Lifecare or the Lifecard?
Lifecard. Okay, so connectivity is one part of the challenge. Storing information about me is the next part of the challenge. The third part is actually working with your care team. And so HotHealth is a healthcare engagement platform or patient engagement platform which allows clinicians to build a community around their practice. So this community can be between clinicians and, so if you're a hospital and you might have a bunch of patients that are obs and gynae patients, another set of patients that are from your cardiology department, another set of patients from geriatric department. You can build communities, engage with them online. So whether that engagement be as simple as doing an online appointment, or whether it be a notification for a reminder to come back, or whether it be an assessment or a form you got to fill out. We've got to, you got to send information to a doctor or so on. So it's an engagement platform. It's building a community that has providers on one side and consumers on the other side. And as a consumer, I can have connect to all my different providers through HotHealth. Now, of course, HotHealth automatically comes with Lifecard. And at the other end, you've got the providers, the clinicians, that have got their own clinical systems, which is their record of your encounter with them. But you have 5 or 6 of those different specialities you deal with, and all of their encounters with you is in your Lifecard, and you're engaging with each of them through your healthcare engagement platform called HotHealth. It's got all the sort of things you'd expect. It's got events. It's got you can publish articles, share videos, engage online with patient portals and buy things. So if you're a clinician that had a particular video on how to best cook healthy meals or something like that, you could transact with your consumers that way. That's what it is.
So these are all amazing applications that your company has designed. So we have RefferalNet, we have Lifecard, and HotHealth. So let me ask you something, Matthew. Do you have any plans to make more applications in the future?
So the ones we haven't talked about is the provider applications. In other words, the systems, the software applications that are used by healthcare professionals. So we have applications for hospitals and for GPs and specialists in allied health and for community health, but these tend to be older style on-premises applications pre the mobile. So the last part of the jigsaw is something we're calling Mastercare Plus, which is a marketplace for clinical apps. Obviously, all our existing products, which we've developed over the last 15 years, are being migrated into this platform, and that'll be for healthcare professionals to be able to pick and choose what features they want and then run it on their mobile or their tablet or their desktop. So we've got Mastercare for the healthcare professionals, RefferalNet for connectivity, Lifecard for the consumer, and HotHealth as a platform for either side to engage with each other. So Mastercare Plus is probably the last part of the jigsaw.
Amazing. Thank you so much, Matthew, for sharing this new information with us. All right. So, Matthew, as you know that nowadays technology has become very advanced and that the healthcare industry is using this in order to provide better service for their patients, especially between doctors and their patients. But now, here's the question I want to ask you. What problems can digital healthcare and technology address?
So the reports I've read talk about multiple adverse events. It sounds like a innocuous word, adverse events, but quite often that's the way they describe mishaps in health that cause serious injury or death, and that's because of the lack of total information. So digital healthcare is really about having the right information at the right time, in the right place, anywhere, any device, sort of thing. Once you have all that information in digital format, the ability to be able to get some insights into the artificial intelligence and predictive analysis and all that sort of stuff becomes a real option. So it's vital, I think, that we get the information in digital format and so that we can apply technology of the future, which whether it be genetics, genome mapping, or whether it be artificial intelligence, to sort of help both sides, the providers and the healthcare consumers, to make the right decisions at the right time. So very simply, it's just about having the right information at the right time, being able to look at trends, being able to understand that there are adverse reactions because this drug doesn't work well with that condition, or this drug doesn't work well with that drug, or you've got a genetic predisposition towards something. All this sort of stuff is just gonna revolutionize healthcare, if you ask me.
Very interesting. Now, Matthew, I'm going to ask you the opposite. What problems cannot be solved through digital healthcare and technology?
That's an interesting one. I think there's still so many. At the end of the day, it needs people with insights. So we're a software house, and when we have a problem that we're trying to fix, we often get 4 or 5 people in the same room together, and we throw ideas. This is one way of fixing it. No, we all agree what the diagnosis is, and then we all agree on the best way forward. So the human ability to sort of interpret all that information is still not going to be replaced in my view anytime soon, right? The human side of dealing with patients. I've got customers that they do test on a patient, and when they know that the result is not the best, the first thing that happens is they're counseled. The patient's being counseled and explain things, because you don't want to say you've got, and it may be something that's entirely manageable. So that human element of being able to work with other humans in being able to to explain things, to be able to reassure people, to be able to is the stuff that machines will never be able to replace, right? I mean, that emotional side of healthcare delivery, and the whole healthcare industry is full of people that have got very strong EQ skills. That's common across all healthcare professionals I've come across, right? So you've got two sides. You've got the decision-making side that technology helps, and then you've got the people side, which is where which will never be replaced by digital or technology.
Very well said, Matthew. Yes, I agree with you that despite the fact we have advanced technology in healthcare nowadays, we still need that human touch.
Absolutely.
Yes, thank you, Matthew. Now, here's the question I want to ask you. Are there any misconceptions about your company you would like to clear out on the show today?
There are. I don't know what the misconceptions are. I guess we think that we never hit the press because we do things quietly. We're the silent achievers, if you ask me, right? We've got customers. A lot of our sales are word of mouth, and probably the biggest criticism of the company is no one's probably heard of us other than our customers or people in particular segments that we target. And there might be a perception that that's it really, is that people don't know us, right, at all, and that's a failing on our part. Or they might know us as one part of the jigsaw. Hospital people, people that work in hospitals associate global health with hospital systems. And we often get new sales just through word of mouth because hospitals in Australia is not a booming market. It's kind of a set at 1,300 hospitals in Australia, and that's been the case 15 years ago. So there's no new hospitals being built, but we still pick up 2 or 3 hospitals a year because old ones are being closed down or old vendors move, and it's word of mouth that gets us the business. Similarly, in mental health, we're extremely strong there. We have probably about, our estimation is we know we've got about 100 different large organizations that are specifically focused on chronic disease and mental health, and we probably have close to 2,000, probably more. We probably have about 15,000 healthcare providers across Australia that are using one of our applications every day. That's a lot. We probably have that's 15,000. Either allied health specialists, GPs, administrators using our applications. That's probably around 3,000 organizations. So we've got plenty of blue sky, if you like. Given that the estimates are that there's probably 150,000 organizations and probably close to 300,000 providers. So we're only just scraping the top. But when we do something, whether it's in one of our specialty areas, whether it be secure messaging or hospital systems or chronic disease systems, or now consumer stuff is new, so I can't indicate the trends are excellent. I can't be happier. People only know us for that little thing. They don't. Not many people understand us as being the full solution, if you like. Being able to support providers, healthcare professionals, connectivity, as well as consumers. People just think of us as secure messaging vendor, or as a mental health vendor, or as a hospital vendor. No one's understood the big picture, and that's a failing on our part, really, not being able to get the messages out.
Don't worry, Matthew. I'm sure with this program, Health Professional Radio, people are going to know more about Global Health Limited. People are going to know more about your wonderful applications.
Yeah, thank you very much.
Yes. So, Matthew, if you don't mind, I want to ask you a personal question. Why are you so passionate about digital healthcare and technology? Okay.
So it's one of those things, I'm from an IT background, IS background, and I started back in the 80s, right, in the early 80s, out of uni. And of course, in those days, you built applications for a particular brand of hardware. So there's two parts to this answer, okay? You either built software for IBM or NCR or Unisys or ICL. All these are names you may not know, but these were the dominant computer vendors of the early 80s, right? And then open systems came along, with Bill Gates and Steve Jobs, And I got really excited. That's when I got into the industry and started building software that now didn't have to run on a particular machine. It could run on any machine, right? Open systems. And we built applications. The company I started built applications for any industry. I was from Perth. The business was in Perth, so a lot of our customers were mining customers and casinos and government departments and travel agencies, you name it, right? It was like a generic software developer. Then in the early 90s, two things happened. One is that the mainframe companies all kind of didn't cannibalize their business, and they were all replaced. There was a new set of players: Hewlett-Packard, Wang, Prime Computers, Sun Computers, and a lot of these mainframe guys, they stumbled, and we were fortunate because Australia had a pretty bad recession in the early 90s, and all the multinationals pulled out because they said, well, Australia's not going to give us the return we want, so they all went back to the States or Europe or wherever they came from. And small companies like us had the ability, were suddenly being considered for large projects, and we built a system for hospitals in WA, for the government. And in the 90s, we just kept getting more and more business in healthcare, and particularly in hospitals. And what struck me was it was so far behind all the other industries, right? So I became passionate about healthcare for two reasons. Number one, a lot of my family, my mum was a GP, and a lot of my family are in the medical trade. But number two, I had first-hand knowledge. I was married to a GP, about how inefficient the whole system was. And it took me a while to understand this, but other businesses, whether it's mining or casinos or travel agencies and so on, they're businesses, and whereas healthcare, the people involved in healthcare are far more sensitive and far more careful. In other words, it's a very conservative industry. They take a long time because the old saying was, you bury your mistakes, right? So healthcare was so far behind the other industries that, and then the internet came along in the 90s. So I was aware of the huge opportunities for radical disruption in healthcare in order to be able to change the way things are being. If we could just do what we do in the rest of our lives, whether it be booking a plane or booking a hotel or choosing a restaurant or finding out information or whatever, if we applied all the stuff we do in other aspects of our life into healthcare, it'll be significantly transformed. So that's what keeps me going, the fact that it's still there to be fixed, if you like, right? That there's the cost involved in healthcare is just spiraling out of control in every article I read, every country, because of the advances in technology, in medications, in us living longer, in quality of life, lifestyle diseases. So the problem is just getting bigger and bigger every year. And I know there's huge opportunities to sort of deal with that problem satisfactorily, to transform it so that the problem becomes manageable. And that's what keeps me going. That's what keeps me going. I mean, this consumer health stuff is what gets me up in the morning, keen to come to work and say, now let's get on to the next step. It's taken far too long in my view, but that's because healthcare as an industry is very conservative and very sensitive, because it's everyone expects it to be an entitlement. So it is not really as free a market as a lot of other industries, because governments tend to have a lot of the responsibility for delivering healthcare to their citizens. So it's a slow, it's a challenging industry, but it's a problem that can be fixed. It's not playing in the peripheries. It's not trying to improve by 1 or 2%. I think if digital transformation really takes off, I think the savings are 15-20%, right? So it's significant in terms of the spend on healthcare, and then in terms of patient outcomes, it's probably undefinable. I mean, I've certainly become a lot more aware of what to do and how to manage my health, and technology just makes it a lot easier.
Wow, that was very well said, Matthew. Thank you so much. Now, what is your main takeaway message to all of our listeners?
I think it's about connectivity, right? I mean, if we can just focus on connectivity between the the thousands of healthcare providers involved in every country that are largely independent and take small steps, then if digital data starts flowing, then we can move on to the benefits of engagement, active engagement, the benefits of artificial intelligence, the benefits of administrative gains, and so on. But the foundation is to get data flowing digitally across healthcare. I know in Asia there's still fax stuff to insurance companies, right? I mean, it's just amazing. I mean, I think the health industry must be the one that's keeping the fax industry alive. So the one takeaway is connectivity. Digital data connectivity is the foundation. Without that, all the other benefits will be much, much, much harder.
For those interested to know about you and your services, how can people get in touch with you at Global Health Limited?
Well, www.global-health.com is our website, and we tend to be a house of brands, so all our separate brands, Mastercare, Lifecard, HotHealth, RefferalNet, have their own subsites and their own URLs. There's plenty of information there. We're listed on the Australian Stock Exchange. Our code is ASX is GLH for Global Health on the Australian Stock Exchange. So therefore, we are very transparent. You can get information from the Stock Exchange on our plans, our forecast, our passions, and of course they can ring us up on 613, 61's Australia, 3 is Victoria, 96750600 is our main line, or just email info@global-health.com. Many ways. I think we've got Tweet and LinkedIn and everything else, Facebook as well, but I'm sure they'll be available from our website.
Thank you so much, Matthew, for coming on the show again. I really appreciate it.
It's my pleasure. Thanks for having me, Tabitha.
And that was Matthew Cherian, CEO and Managing Director of Global Health Limited. We've just been talking about the amazing apps that his company offers, such as Lifecard and HotHealth. If you like this interview, transcripts and archives are available at www.hpr.fm. We are on all social media platforms, so don't forget to follow, like, and subscribe. We're also available for download on SoundCloud and iTunes. I'm Tabitha Moreto, and you're listening to Health Professional Radio.